we know that the pharmacist is really a lifeline to many Americans. And so we want to make sure that we work hard to take care of our patients, to make sure that consumers have everything that they need to live healthy lives.
Good afternoon, Michael.
Good afternoon.
I'm Thomas Grenier. I'm in charge of the vaccines business for Sanofi in North America. I'm glad to be here with you today. How are you doing?
I'm great. It's good to be with you too.
Excellent. You're the CEO of APhA's. Do you want to say a bit more about what your role there?
Yes, I'm the CEO of the American Pharmacists Association.
Brilliant. What do you want people to know about your mission with APhA?
Well, APhA wants to ensure that consumers have access to the care services of a pharmacist wherever and whenever they interact with our healthcare system. So whether that's in a hospital or out in a community setting, we just want to do everything we can to make sure that consumers continue to have access to their pharmacist.
That's a great mission. What do you hear from patients? What compels you to do your work every day?
Well, we know so many consumers in the U.S. live in very, very rural and underserved communities. They live in places where oftentimes the community pharmacist is the only healthcare provider that's available to them in the local community. And so we know that the pharmacist is really a lifeline to many Americans. And so we want to make sure that we work hard to take care of our patients, to make sure that consumers have everything that they need to live healthy lives.
You mentioned your patients. What's the one thing that we need to do, continue doing, do better to help them every day?
Well, we definitely need to support a different payment paradigm and coverage paradigm for pharmacists and their care services in the United States. Unfortunately, we've had a lot of pharmacies closing in the U.S. in the last year as a result of the pandemic and reimbursement challenges that pharmacists face. We need to make sure that consumers have coverage under their insurance and under the federal Medicare program for the services of a pharmacist so that those pharmacists can keep providing that care. It's very, very critical, and we hope that consumers will join us in ensuring that that coverage exists going forward.
Great. Yeah, that makes a lot of sense. The economics is very important to sustain presence and continuous care for patients.
Yeah, absolutely.
Look, on a positive note, what gives you hope for the future of scientific innovation?
Well, I mean, it really, if you consider all of the wonderful opportunities that we've had to prevent disease over time, and, you know, diseases that were killing millions of people around the world, and now we have vaccines that prevent them. And, you know, pharmacists, I think, are very driven by science. We have an underpinning in science, and we always look at the innovations that are out there, and it's exciting in the vaccine world, particularly some of the new innovations that are coming out that will allow us to prevent an even larger number of infections and improve the human condition. So it's really an exciting time in science.
Look, that's great. We're very excited to continue the good work together. We as manufacturer, together with you and your members, and providers and pharmacists have such a key role to play in public health. So it's great to be here together and discuss this exciting topic. So thanks a lot for your time, Michael. I appreciate it.
My pleasure. Thank you.
Thank you.